Implant the tined lead using a lead introducer kit. Components of the lead introducer kit include the directional guide, dilator, and introducer sheath. The tined lead is shown here. As with other leads for interstim therapy, it has 4 electrodes: 0, 1, 2, and 3. 0 is implanted most distal. There are also lead contacts that are used for intraoperative testing. They correspond to the electrodes and are also numbered 0, 1, 2, and 3, with 0 being the most distal. To insert the tined lead, first remove the foramen needle stylet and replace it with the directional guide. Note the depth markers on the guide. Holding the proximal portion of the directional guide in place, gently remove the foramen needle, being careful not to move the directional guide. Verify placement with fluoroscopy. Make a small skin incision at the exit side of the directional guide. Place the dilator and introducer sheath over the guide and advance into the foramen. Use a slow, rotating motion if insertion is difficult. Align the bottom of the third most proximal depth marker on the directional guide with the top of the dilator. This will align the tip of the dilator with the tip of the directional guide. Again, verify lead placement with fluoroscopy.
And so I can see my little radio-opaque marker right now is on the posterior surface of the bone. So I'm going to want that to be almost all the way down to the anterior surface. Yeah, let's take a look again. See, right now it's in the middle. And now I'm going to go just a tiny bit more. Let's look again. Right now it's on the anterior surface.
Next, twist the hub of the dilator to unlock the dilator from the introducer sheath. Then remove the directional guide and dilator, leaving the sheath in place. Insert the tined lead into the introducer sheath and advance the lead until the distal visual marker band on the lead lines up with the top of the introducer sheath handle. Use fluoroscopy to confirm that electrode 0 is proximal to the radiopaque marker band at the distal tip of the sheath. Advance the lead into the foramen, making sure not to advance beyond the proximal visual marker on the lead. The tines will not deploy as long as the proximal visual marker is observed. Test the 4 electrode sites for response, ensuring all 4 electrodes are distal to the introducer sheath. If inadequate responses are obtained, pull the lead back into the sheath and reintroduce into the foramen and retest. Once appropriate responses are obtained, the tines can be deployed. Once you are satisfied with the lead position, hold the lead in place and carefully withdraw the introducer sheath and lead stylet. The tines will deploy as the sheath is removed. Obtain a lateral and AP view of the lead placement. The lead should curve cephalad to caudal on the lateral image, with electrodes 2 and 3 straddling the anterior portion of the sacrum. The lead should lie medial to lateral on the AP image. To confirm previous responses, test all 4 electrodes again.